Hello juniors, so I welcome you all again in the continued series of upper limb and thorax, and today we are going to cover an important topic which is intercostal nerves. And in today's lecture we will be covering its introduction, classification, codes, branches and relation. And in today's lecture we will exclusively cover the typical intercostal nerves. So without wasting further time, let's move ahead. So, as the name suggests, intercostal nerves, the name literally means the nerves which are present in between the ribs. So, intro group of 11 nerves starting from T1 to T11 that arises from anterior rami of thoracic spinal nerve. So, it is a group of nerves, and by the way of review, I am drawing the cross section of spinal cord for you. This is the cross section of spinal cord and it gives off the branch. This is our posterior root. This one is the anterior root which merges together and a spinal ganglion is formed. This is our spinal ganglion which further continues and known as spinal nerve, and this spinal nerve gives the branch called the anterior rami, and this one branch is called our posterior rami, also called the posterior branch or anterior branch. So from the anterior rami of thoracic spinal nerve, the 12th thoracic nerve forms the subcostal nerve. So this is the last nerve which lies beneath the 12th rib. That is why it is also called the subcostal nerve. And lastly, intercostal nerves not only supply the intercostal spaces but also other structures like upper limb and abdominal wall. So this forms the basis of classification of intercostal nerves, which are classified as typical and atypical intercostal nerves. So typical intercostal nerves supply to thoracic wall only. It comprises of T3, T4, T5 and T6. These are the nerves arising from spinal cord at the level of 3rd thoracic vertebra till the level of 6th thoracic vertebra. And atypical intercostal nerves supply other structures as well. Likely I have got T1 and T2 which supplies intercostal space and upper limb, and likely I have got T7 till T11 which also supplies intercostal space and abdominal wall. Therefore, these nerves are also known as thoraco-abdominal nerves as they supplies both thorax and abdomen. So done with the introduction. So I'll give you the short briefing of intercostal nerves. Then we will dive into its details. So basically this is our intercostal nerve which passes behind the posterior intercostal vessels. These are the posterior intercostal vessels. Intercostal nerve passes behind these vessels and give a branch right here to the sympathetic ganglion. Gives a branch to the sympathetic ganglion right before piercing the intercostal membrane. This is our intercostal membrane. It goes posterior after piercing the intercostal membrane, and it goes posterior after piercing intercostal membrane and comes forward, and while coming forward it gives numerous branches which we will talk laterwards, and in the near end to the sternum, here near end to the sternum, It moves in front of internal thoracic vessels. These are the internal thoracic vessels, and end up giving its anterior branch called anterior cutaneous nerve. This is the anterior cutaneous nerve. So this was a short briefing of its course and relation. Now we will go into the details of its courses. So this is the cross section of the rib, which I have, if you take it from right here and zoom it down, we will get this diagram, which is, so this diagram comprises of intercostal vessels, which are vein, artery and nerve, and these three layers of muscles, which are the innermost muscle, the internal intercostal muscle and the external intercostal muscle. Starting with its course, intercostal nerves run in the costal groove and ends near the sternum. So this is the costal groove of a rib. Intercostal nerves run in this costal groove and end near the sternum, as I've shown you in previous diagram. Typical intercostal nerve enters the posterior part of intercostal space by passing behind the posterior intercostal vessels. This is what he's saying. It enters the posterior space. Now it enters the posterior space by piercing the intercostal membrane. Intercostal nerve lies lowest in the neurovascular bundle. So this is the neurovascular bundle, and intercostal nerve lies at the lowest position. The order from above to below is vein, artery and nerve. This is our vein, this is the artery, and this is the nerve, which can be remembered by the van word. At the anterior end of intercostal space and intercostal nerve, the intercostal nerve passes in front of internal thoracic vessel. So this is the diagram. This one is our spinal cord. This is the spinal ganglion, and this is our anterior rami, and this is the posterior rami. This is spinal nerve gives the branch to the spinal ganglion, which I have also told you earlier. It then goes forward in front of thoracic vessels and gives its branch called anterior cutaneous branch. It pierces the internal intercostal muscle and anterior intercostal membrane to continue as an anterior cutaneous branch, which ends up by dividing into medial and lateral cutaneous branch. So what he is saying here is, it pierces the internal intercostal muscle. So this is our innermost muscle, innermost intercostal muscle. This is our internal intercostal, and this is our external intercostal muscle. It pierces the internal intercostal muscle. The nerve pierces. Here is the nerve. I am tracing the nerve. It pierces the, this is our internal intercostal muscle. It pierces the internal intercostal muscle and anterior intercostal membrane. This is the membrane. It pierces both of them to continue as anterior cutaneous branch. This is the anterior cutaneous branch, which ends up by dividing into medial and lateral cutaneous branch. This is our lateral branch and this is our medial branch. Clearing away my ink for you. Once again showing you, this is the anterior cutaneous branch, which further divided into medial cutaneous branch and lateral cutaneous branch. So done with the course of intercostal nerve. Now the branches. As I have already told you, there are chiefly four branches of intercostal nerves. Firstly are communicating branch to the sympathetic ganglion. As I have already told you, this is the schematic diagram of typical intercostal nerve. So you will draw this diagram in your university exam and will surely get a higher score. So our first branch is communicating branch to the sympathetic ganglion. This is our sympathetic ganglion and the communicating branches. Secondly, I have collateral branch. So collateral branches are the numerous branches given in between by this intercostal nerve, which supplies intercostal muscle, costal pleura and periosteum of the rib. Thirdly, I have the lateral cutaneous branch, which is given at mid-axillary line. Suppose this is our axilla, which is given at mid-axillary line and which further divide into anterior and posterior branch. Clearing away my ink for you. This is our lateral cutaneous branch. This is our lateral cutaneous branch, which further divided into posterior division, and this is our anterior division. And lastly, I have anterior cutaneous branch. This is our anterior cutaneous branch, as I have already told you, which further divided into medial. This is our lateral branch and this is our medial branch. So these were the main branches of typical intercostal nerve. So lastly, covering the relations of intercostal nerves. Now this would be much easier for you as we have already covered its courses and branches. So the first he is saying, in costal grooves, intercostal nerve runs in costal groove in the order of VAN. As I have already discussed, the topmost is our vein, then artery and then nerve. In the posterior part, nerves run in between the intercostal membrane and subcostal muscle. So here in the posterior part, the nerve run in between the intercostal membrane. So this is our intercostal membrane, and here are the longitudinal muscles which are known as subcostalis muscle. So the nerve run in between this membrane and the subcostalis muscle. In the mid part, the nerve lies in between the innermost muscle and the internal intercostal muscle. This is our innermost intercostal muscle, and this is our inner intercostal muscle. And lastly, in the anterior part, the nerve pierces the internal intercostal muscle and comes in forward and passes the internal thoracic vessel to give the anterior cutaneous branch. Let's see what he is saying, that in the posterior part, nerve run between the intercostal membrane and subcostalis muscle. In the middle part, and run between the inner intercostal and innermost intercostal muscle, as we have discussed. And in the anterior part near sternum, nerve crosses the front of the internal thoracic vessel and sternocostalis muscle. This we have also discussed. Now this is the schematic diagram of the cross section of intercostal space. Here lies our intercostal vessels, and here are the collateral branches. These are the same collateral branches that we have discussed there, which supplies numerous intercostal muscle, costal pleura and periosteum of the rib. This concludes our module on intercostal nerves. Now we are done with introduction, typical intercostal nerves, course, branches and relations. So if you found this video helpful, do like it and do share with your friends. Thank you.